So today we have with us two presenters, and I think Kinjal is actually our second presenter for today, but I'll go ahead and introduce her right now. So Kinjal is part of the Toronto Research Information Outreach Team and is a senior postdoctoral research fellow at the Hospital for Sick Children, working on developing a novel treatment for medulloblastoma, the most commonly occurring malignant brain tumor in children. She's also an instructor at the University of Toronto's School of Continuing Studies and has guest lectured at the University of Toronto Molecular Genetics Department. And so our next speaker as well is Roshane Francis, and Roshane is a recent Sick Kids PhD graduate working as a postdoctoral fellow in Dr. Party's lab at UFT. During her PhD, Roshane studied how the embryonic stomach develops in mice and used these insights to study gastric cancer initiation. Wanting to explore more translation-specific opportunities, her postdoctoral studies involve engineering bacteria to secrete therapeutic compounds for the treatment of inflammatory bowel diseases. So I think with that introduction, I'll hand it over to our presenters.
Thank you so much, Niveda, for the introduction and also for setting up this webinar. So hi, everyone. My name is Roshane, and as mentioned, I am a a postgraduate student at UFT. And today I thought it would be good that me and my colleagues, me and Kinjal, go over quality of life research that's being supported by the Canadian Cancer Society. So specifically, we're not going anywhere. Okay, so specifically, before we get into the meat of our PowerPoint, I wanted to just go over what team that Kinjal and I are part of. So we're part of a group called RIOT, or the Toronto Research Information Outreach Team, and we're affiliated with the Canadian Cancer Society. And our goal is to provide information about up-and-coming cancer research and also to help to make this research more accessible to the general public. And we do this through community and high school talks. And we also post blogs about the new cancer research that's taking place. And if you're interested, you can definitely go check out torontoriot.com. And specifically, who are we? So we are cancer researchers who volunteer with the Canadian Cancer Society. And as I mentioned, our goal is to share our knowledge and highlight any current research. However, we are not licensed medical professionals and we're not qualified to give any medical advice. So we highly suggest that you always consult your family doctor and oncologist for questions pertaining to specific medical cases. So first, we just wanted to go over how is research established, how does research take place, or how is it funded? And specifically with CCS, or Canadian Cancer Society, it works by researchers or lead scientists applying for funding where they write up a proposal and they submit it to CCS. And in 2016, they had about 838 applications. CCS then asks a panel of experts or other scientists to peer review these applications. And then these panel of scientists will go over the proposals and recommend which projects should be funded. Ultimately, only about 12% of all applications get funded, and these are based on merit and the innovation of the study. So it's a highly competitive process, and specifically, this is based on funding that CCS receives from the public. So there are three main areas where CCS invests in research. The first one being prevention, where we're trying to look at different aspects of preventing cancer initiation. We also have basic biomedical and translational. So this is what Kinjal and I are part of. And this is looking at more the biological functions that take place within cancer on a molecular level. And also a third aspect that we look into is something known as the quality of life research. So quality of life research is basically looking at how people who have been diagnosed or treated or undergoing cancer therapies, how are they dealing with how is their quality of life affected upon cancer treatment? And one big field of subfield within quality of life research is known as survivorship. So basically, how is money invested into three of these big fields? You can see for quality of life research, about 10% or 9% is being, and $3.5 million is being invested into quality of life research. And as I mentioned, a bulk of that goes into survivorship research. So survivorship research is basically looking at how do patients deal or get back into their lives post-cancer treatments. And this is just, there's many aspects to quality of life to determine the quality of life. So here I'm just showing you some examples. So this includes your physical, psychological, spiritual, and social well-being. And all of these areas can be affected upon receiving a treatment or receiving diagnosis of treatment. And the goal of this research is to enrich or enhance the quality of life of these patients and to take them back or to return to their previous quality of life prior to the cancer diagnosis. So breakthroughs in cancer treatment has led to an increase in cancer survival over the past 50 years. And essentially, some of these treatments have unwanted and long-term side effects. And I'll go into some specific treatments and why and DNA mechanism of why this potentially happens, of why this happens. And basically, survivorship research is how do we treat and prevent these long-term side effects? So basically, survivorship research is wanting to look into beyond just surviving, we want to look into thriving. So can you excel or can you thrive post cancer treatment? And right now, one of the conventional therapies available is called chemotherapy. And as it has increased, and as it's increasing cancer patient survival rates, it's also important to look at these treatments after. So specifically, one of survivorship research is important because chemotherapy is not specific. So the mechanism works by attacking proliferating cells that eventually lead to cell death. However, although cancer cells are highly sensitive to this treatment, there's also few healthy cells there are a subset of healthy cells that are proliferating, and they're also affected by this process. Accordingly, this can lead to short-term and long-term side effects. So short-term side effects can include fatigue, hair loss, and mental fog, while long-term effects may include fertility and damage to healthy tissues. So a lot of times when oncologists or doctors prescribe these treatments and drugs, they have to take into account the cost-benefit ratio of these treatment options, and it may vary specific to each patient case. So for instance, if you look at radiation dosage, it's important that while it's important to pick a dosing that will affect your cancer cells, but alleviate or minimize the effect on your other healthy tissues. Especially if it's a younger individual, they would potentially want the option of being fertile later. And you also have different drugs that can be used to treat the same cancer, but may have different long-term or long-term effects. So depending on each patient's unique values and what kind of life they wish to lead, will also take into account how these drugs are being administered. So I thought it would be interesting to quickly go over some current quality of life research and clinical trials that are taking place and that have been funded by CCS. So one study found that integrating palliative care earlier on in treatment greatly enhances the patient's quality of life post-treatment. Another important finding was that improving smoking quit rates allowed for a much faster recovery in cancer treatment, and this has also been incorporated in Ontario and BC. And lastly, to improve the psychological well-being of patients, linking cancer patients with online communities to talk about their trials and woes actually helps them to process and have better process their treatments better and have a better quality of life. There's also some very interesting quality of clinical trials undergoing right now, looking into how to improve the quality of life. So one was how to reduce the fear of worrying about cancer reoccurrence. So they found that, again, assigning patients post-treatment with a one-on-one session with an oncology nurse and helping them to report their symptoms and self-management really helped with reducing the fear involved in potential cancer recurrence. They also found that there's also a trial about helping younger patients who have gone radiation therapy, who previously had a brain tumor, to that if they undergo 15-minute training sessions with a home-based computerized training program, that their getting back their cognitive abilities was much quicker. Oop. And lastly, sorry about that. The last point was basically going through mindfulness and meditation also help dealing with improving quality of life. And lastly, I also told you that there was basic and molecular biology research where we look at the cancer biology on a molecular level. And this can also indirectly improve patient quality of life. And as I mentioned, so chemotherapy is a very non-specific form of treatment, so it attacks both cancer and normal cells. But with improving research and innovation, we're looking towards more targeted therapies. And basically, you want to find a defect that is specific to cancer cells. And here I'm just talking about how there's different types of drugs that are a bit more targeted than chemotherapy. And again, the more we can understand the different molecular features found within different types of cancer, this will really help in prescribing having a better diagnosis and also using very specific drugs involved. So I just wanted to give you a quick example of how basic biomolecular research can actually help with the quality of life for patients. And specifically, I'm talking about medulloblastoma, which is a type of brain cancer. So through DNA sequencing, it's been shown that there's different subsets of medulloblastoma. However, they all have different clinical outcomes. So for example, a subset known as WNT, WNT, actually has a pretty good clinical outcome, and perhaps group 3 has a worse or a poorer clinical outcome. So they found that for younger individuals that tend to have the WNT subgroup, they don't have to treat it as harshly, and thus will reduce the dosage and help them improve their quality of life later on. So I just wanted to, sorry, these animations are going off on their own. Okay, sorry. Yeah, these animations are going crazy. But just to quickly go over what this slide was talking about was there has been a paradigm, there we go. There has been a paradigm shift in cancer treatment. So cancer survival, if we compare it to old in 1940s, was much worse. So for childhood cancers, there's almost no chance of survival. Breast cancer was less than 30%. And this had a very high cost on the quality of life for surviving patients. However, with improved research in all three fields, we have almost doubled since the 1970s. So now brain cancer in the young is much better. About a third survive in relatively good health and a third survive with serious health consequences. And lastly, with surgery, there's also much better much lower rates of cancer recurrence, and also better quality of life outcome. So as we develop our research and progress forward, hopefully we can have more specific cancer treatments with less side effects, and also incorporate more physiological and physical methods of helping patients have a better quality of life post-treatment. Okay, so I will let Kinjal take over the talk. Thank you, everyone. And yeah, I can answer any questions towards the end.
Terrific. Thank you very much, Roshane. I hope everyone can hear me, and it's nice to be here. I hope everyone's doing well. Just coming back to the slide on, Roshane, just interrupt me if there's like issue with my video or audio, okay? Yeah, so coming back to this slide of quality of life, and Roshane mentioned the term palliative care. There's actually sort of a misnomer as to what palliative care actually means. It's purely an or defined as an interdisciplinary medical caregiving approach aimed at optimizing quality of life and mitigating suffering among people with serious complex illnesses. So it doesn't necessarily mean end of life care. It basically means improving quality of life of any patient or their families with a complex disease. And so as Roshane already alluded to, there are so many aspects of quality of life, physical well-being being only one of them. There's, of course, psychological well-being and social well-being and spiritual well-being, and improving quality of life in these different ways definitely does sort of increase overall health of any person. And so Roshane mentioned that sort of targeting the molecular biology research to decrease side effects is definitely a big aspect of quality of life research. But of course, there's also research aimed at targeting these different aspects of the quality of life as well. And so there's a review that was published over a decade ago now, outlining the most common sort of approaches to what's known as complementary and alternative medicine. Of course, research in this area is very subjective, and so it's still being sort of refined, but there are several reasons why complementary and alternative medicine, CAM, are popular. CAM practitioners or CAM medicine, it aims not to only to treat the physical or biochemical aspects of illness, but also considers the more holistic, nutritional, emotional, sort of social and spiritual context in which the illness arises. And so some of these on this pie chart are biologically based approaches, which would mean ingesting of food supplements or dietary supplements, herbs, vitamins, things like that. Usually these supplements are not regulated by any food body. So that's something to keep in mind. There are also manipulative and body-based therapies like massage, chiropractic, and osteopathy. And then there's mind-body interventions, which we'll talk about a little bit more later, which include yoga, meditation, spirituality, and relaxation in different guided ways. And then there's the other aspect of alternative medical systems such as homeopathy or naturopathy. And then there are also the energy therapies, which include Reiki, some magnetic interventions, Qigong. And so these are the ones that sort of have been reviewed and are very frequently used by a lot of people. Of course, it's very important to know that complementary therapies do not treat the cancer itself and are not aimed to. They do tend to help improve your overall health and well-being. This can be done in a number of ways, including helping to cope physically and emotionally with more conventional cancer treatments and the standard of care. An example of this is having acupuncture to help with nausea caused by chemotherapy. Right? So there's a few different ways in which complementary sort of medicine is different from alternative medicine, which is in that it's not a replacement of medication, but sort of in tandem with current standard of care practices, and it's intended to maybe alleviate side effects and secondary symptoms. So studies have shown that many people living with cancer have used at least one complementary therapy as a part of their cancer treatment. However, research in this area, as you can imagine, is very subjective and difficult for a number of reasons. It's difficult to accrue this data. There's a lot of non-compliance, for instance, sort of in the studies, and we'll talk about a few studies looking into different methods of complementary medicine and health. It's sort of very trust-based, that you trust that the person is going to, let's say, exercise for 30 minutes every day, that kind of thing. There is a dropout rate, and there are a lot of reasons why it's not easy to maintain keeping up a certain lifestyle regimen. And yeah, I think everyone can relate to that problem. Also, the measures of some of these studies, almost all of them so far are very qualitative. It does depend on each person's view of good quality of life, or let's say pain threshold. People have different pain thresholds, things like that. And so it is very qualitative. and the responses are, of course, subjective for that reason. However, all of the studies tend in the same direction, or trend in the same direction, which is that complementary medicine of a variety of approaches do reduce stress and improve quality of life during treatment. And so let's talk about a few of the different complementary health approaches that people take. And so this was a US study taken among over 86,000 adults in 2012. And so this includes patients, not patients, sort of everyone. There was also a variety of age range and different ethnicities, different demographics. But overall, taking in natural products was sort of the most common complementary health approach. So this is an older study, but I think the trend kind of continues. Following this was deep breathing. A lot of people practice yoga, Tai Chi. And then following this were chiropractic manipulations, osteopathic, and then meditation, and going all the way down to progressive relaxation and guided imagery. And so I can't really see the chat, but is there anything else you could think of? Please feel free to type into the chat if you'd like to share. If there are any other methods that you know of, someone else using or yourself using that might be sort of relevant in this scenario. I'll just pause for a sip of water if anyone wants to share. No pressure at all, of course. Maybe Roshane can let me know if someone's typed anything in, because I can't see the chat.
Yeah, for sure. Oh, going to the spa. That's a nice one.
What's that?
Going to the spa.
Oh, going to the spa. Oh, that's such a good one. Yeah.
Thanks, Jennifer.
Massage. Yeah, that's great. Yeah, so yeah, there's a lot of different ways in which people can sort of feel more maybe centered or more relaxed. I like going for walks. You know, everyone has their own way. You could maybe talk to a friend, or, you know, put on some music, some candles. It's everyone has their own way to sort of relax, try to feel better, but of course it doesn't always work. Anyway, so let's move on to, okay, got a couple more responses. So great, like going to the spa I really like. And okay, so I mentioned walking, and the reason is because of exercise. And so there is a couple of studies that show that there is a drop in physical activity after cancer diagnosis. And there's, of course, a lot of different reasons for this. After initial diagnosis, there's a lot of demoralization, there's fear. You may start to experience your effects of chemotherapy or radiation therapy, feel tired, pain, or soreness. Of course, sensitivity in certain areas. You may have bloating, you may feel confused or depressed. There's a lot of emotions going on. So there's a lot of different reasons why there is a drop in physical activity, and these are completely understandable. At the same time, the effects or the benefits of exercise are still very, very important. And so let's just walk through a few of them. About 30 minutes of walking every day does have a lot of positive effects in all people. There are studies, various studies, which have been summarized over a few reviews that show that sort of walking can alleviate fatigue or depression, make you a little bit more alert and active. There's also, strengthening of your muscles, of course, improving fitness, maybe keeping weight in check. Of course, as always with these kind of lifestyle studies, there are very few studies available, and they're all observational. But there are definitely some positive effects, as I mentioned. So about 4 hours of walking, of brisk walking every week, sort of showed that there was a 40% lower risk of recurrence of breast cancer. Once again, it's important to keep in mind that these studies are difficult to interpret. So the exact numbers are not always sort of easy to really conclude. At the same time, it's important to know that they all trend in the same direction. It's very positive. women who are overweight at breast cancer diagnosis are at a higher risk of recurrence. Exercising several weeks, however, helps decrease body fat, which we know, and also hormones associated with cancer prognosis. And it's also known to decrease nausea, depression, and anxiety. So I'm going to just walk us through a few ongoing and case studies that specifically look at different aspects of complementary medicine or exercise and in cancer treatment or post-cancer treatment. So this one is an ongoing study which began in 2017 and it's still going on. It's called Physical Exercise Following Esophageal Cancer Treatment, or PERFECT. This study was conducted in the Netherlands, and let's see, I've got it here. It was a multi-center randomized control trial, which means that the patients, 150 esophageal cancer patients, were recruited, and these patients were to have surgery with curative intent, and then they were randomly allocated into either an exercise group or a usual care group. The exercise group involved carrying out weekly aerobic and resistance, being enrolled in an aerobic and resistance exercise program once a week, which would be under the supervision of a physiotherapist near their home. And they were also asked to exercise or be physically active for at least 30 minutes every day of the week. And that was the exercise group. And then the usual care group were asked to carry on with their habitual activity. If they were very physical or physically active, then to carry on like that and just basically continue. As always, the study was a 3-month study. And then after that, the primary outcome was to fill out a health-related quality of life questionnaire. And then the secondary, the secondary outcome were to look at levels of fatigue, anxiety, depression, sleep quality, etc. And I don't know if I have, so this is kind of an ongoing study. So far, the preliminary results seem to be that there is a decrease in fatigue, but sort of slightly improved quality of sleep and sort of better cardiorespiratory fitness. But the study is still sort of ongoing, and it kind of sparked a number of other studies that looked at not only exercise, but overall mind-body therapy. And so what is that? Mind-body therapy is sort of a more holistic forms of therapy that not only address physical aspects, such as the ones included in physical exercise, but also sort of try to get at or work on the mental state. It's known to reduce anxiety, fear, phobia, anger, all of these things, promote an overall sense of well-being. It includes meditation, hypnotherapy, yoga is a very popular one, Tai Chi, music therapy, for people who are fond of music, and mindfulness overall. So there have been a few small trials in these areas as well. And these trials did reflect a reduction in anxiety, depression, and distress, and improved emotional well-being. So I'm just going to kind of walk us through a couple of studies that were done in this area, specifically focusing on yoga. And so in this study, it was a case study of yoga and fatigue in breast cancer patients. It included 91 breast cancer patients. They were either randomly allocated into an integrated yoga program or a support therapy and education program, about a 50-50 split. And some of the metrics that were measured after 3 months were stress and fatigue. So this perceived stress, fatigue frequency, severity, of course, cortisol levels sort of coincide or sort of correlate with stress. And so that was measured also. And that's kind of one of the earlier studies that tried to find a physical or sort of a molecular metric by which to measure something that's usually more qualitative. And then finally, they also used a measure of the immune system, which is to check the white blood cell count. In patients, the patients received 24 yoga sessions, and the outcomes were measured. So yeah, I have it written out over here too, where there were 91 patients and they had metastatic breast cancer. This was over a 3-month period, and the assessments were carried out before and after the intervention. The results suggested that the yoga actually significantly reduced perceived stress, fatigue frequency and fatigue severity, and improved sleep quality compared to supportive therapy. And so this was kind of a smaller study with around 91 patients. And this sparked a larger study with a lot more patients. Conclusion results. The results conclude that the yoga does reduce fatigue in patients. So there was another study kind of sparked by this study, and this was based on the idea that radiotherapy, which is often the final step in multimodal treatment for women with breast cancer, sort of causes a lot of adverse treatment-related effects. And these can, of course, negatively affect physical, psychological, social, and spiritual aspects of life, and decrease quality of life, and also create negative health consequences. And so this study tested if participation in yoga 3 times a week during the radiotherapy would have long-term effects on physical and mental health aspects. So the different groups in this study were a yoga group. So there were a few more patients in this case, about 164 kind of consented from almost 300 approached. There was a yoga group that participated in yoga 3 times a week. There was a second group that was asked to do stretches 3 times a week, but it was not a yoga practice, which maybe distinguishes that yoga is more of a mind-body approach, whereas the stretch group was more of just a body approach. And then there was a waitlist group waiting to try out these practices, but at the moment they were not receiving any kind of stretch or yoga therapy. And so that was considered the control group. And so this actually did have some quantitative results. And so we'll just kind of go over those charts very briefly. But this group reported that when patients were asked before and after to fill out the questionnaire, they seemed to show an increase, or sorry, a decrease in perceived fatigue. And so the blue line is sort of the line where you see that the fatigue, which is would be at 0 if it didn't change at all, sort of ends up going lower than 0. In the yoga group, that's blue. The stretch group sort of goes up and down a little bit, and also seems to decrease fatigue compared with the waitlist group that doesn't have a reduced fatigue. The other thing that was mentioned, sort of asked about, was an improved general health. And so patients were asked if they experienced an improved general health. And in this situation, you see that the blue line, so the measurement is across time. So they start with the end of radiotherapy, and the questionnaire is also repeated at 1 month, 3 months, and 6 months. And what this is showing is that there's not only a shift in improved general health in the patients that were performing the yoga practice or practicing yoga during radiotherapy, but that it had a long-term effect, because the yoga therapy sort of carried on for as long as they were undergoing radiotherapy and stopped after that. Of course, it's hard to know whether patients carried on with their own practice or not, but it definitely does seem to be some kind of a long-term effect. In the case of the improved general health, actually, yoga alone seemed to perform better than either the stretch alone or the waitlisted group. And then finally, they also noticed reduced cortisol levels, 45 minutes, 8 hours, 12 hours into bedtime. So looking at it kind of over the day of patients that had received either yoga practice or just the stretch. And you see again that yoga outperforms just stretching alone, which seemed a little bit, sort of comparable with just the waitlisted control group. And so Once again, these studies are quite subjective, but at the same time, it is important to note that targeting both mind and body does seem to have long-term benefits. And so this is a final case study, I think. Let me see. Where there was a mindfulness meditation group session performed, and this was done in about 90 patients across all cancer types. The mindfulness meditation sessions were about 1.5 hours every week, and this carried on for 7 weeks, and they were also asked to carry out daily meditation. And the results were also qualitative, but patients were asked before and after. And then there was a 6-month follow-up that was completed by over half the patients to fill out these questionnaires reflecting their state of what's called profile of mood states. And this included aspects such as anxiety, depression, anger, fatigue, and confusion as sort of the more negative mood states, and then vigor as a positive one. And there seemed to be quite a dramatic shift in the negative mood states and increase in vigor of the patients that did carry on and complete this program of the mindfulness meditation session. And so once again, it's kind of nice to see these studies starting to come up, which do measure things that are very difficult to measure, but seem to show very positive benefits to sort of the mind-body integration and finding benefits during and after cancer treatment. And so some of the take-home messages from our session, and I do believe we will have quite a lot of time for questions and a discussion, is that physical activity has many health benefits. More research is needed to understand the role of reducing the of physical activity in reducing risk of cancer recurrence. Of course, some exercise is better than none, and this is true for absolutely anybody. In many cases, or in all cases, reducing stress is useful. It's of course easier said than done, and so it's something to keep in mind, but sort of having a practice of yoga or meditation might help in that direction. And also to remember that's not just an exercise, but to find something that you enjoy to do, that you can stay motivated and committed. That's certainly something that I need to work on. It's very hard to exercise and to keep it up. And so finding something that you really like, or maybe putting in a podcast or some music to sort of keep the motivation going is a good idea. And of course, one size doesn't fit all. Often people need to try a few different things and then find the one that really works for them or makes them feel better. And of course, all this is well and good, but you and all of us would need medical clearance from an oncologist in the case of trying to incorporate lifestyle changes, physical exercise changes during cancer treatment. And so with that, we'd like to thank you for your attention. Please feel free to visit us at torontoriot.com, check out some of the blog articles we've been writing. We also have a Facebook page and Twitter, and actually also recently Instagram page, whatever it's called, I'm not sure. And so feel free to check it out, and we'd be happy to sort of chat with you and take any questions.
So thank you so much, Kinjal and Roshane, for that presentation.